Hi, you guys. Welcome from that very short report that we got to see about the food festival. Again, trying to make sure you know when the next one's coming up. We'll also let you know here on Good Morning KSI. Nevertheless, today we said we're talking about vaccinations, and this is something very important for every child. But I believe it's really important for parents to know the benefits of it, and plus when is a good time to give it to your child. Joining us here in the studio of Good Morning KSA for this morning is Dr. Manaf Shakir, who is a consultant in pediatrics. Assalamu alaikum to you, sir.
Alaikum assalam.
How are you doing today?
I'm fine, thank you.
Thank you so much for joining us in Good Morning KSA. And today we said we're talking about vaccinations, and as every parent knows, it's something very important for children.
Yeah.
Now, to begin with, sir, can you give us an idea of why is it important to give vaccination to children at the right time?
Okay, you know, a newborn delivered with immature immune system, and he needs a time to build his immunity.
Okay.
And during the first few months of life, the maternally transferred antibody from the mother to the baby, and especially in the last month of pregnancy, giving some immunity and helping the child, the baby, to fight with against illness. So if we are not giving the immunization, and if you said what's the importance, I can ask you one question. Just go back 200 years back and imagine the millions of people who died because of infectious disease. And alhamdulillah, because of immunization, now some of the disease, some of the parents may ask, why I immunize my baby? What is such a disease? I don't know him. But he can see this illness soon if he didn't give immunization to his baby.
That's very true.
So it is very important, and it prevent the babies from getting many illness. Most of them are a killing disease. Some of them can cause cripple babies. So the importance is is very important here.
That's good.
Absolutely. Of course, this is very true. But Dr. Manaf, many mothers, and I'm saying mothers because mothers tend to care more for their children, are now starting to recognize the importance of giving their children their vaccinations on time and actually following the schedule that we have here in the kingdom. Now, initially, from the medical side, what actually happens when we give the child the vaccine or the immunization, as it's known? What happens through the cells of the body? How does it actually help to prevent infectious diseases in the body?
Actually, we are giving a small germ. It's either killed or attenuated germs or part of the germs, mimicking and make the immunity practice fighting of the illness. And when this part of the germs enter inside the body, our immune system producing antibodies against this small part of germs and practicing fighting. So when the real germs or real infection happened after that, the immune system will recognize and fight the illness, and this will protect our babies from the disease. This is simply what's immunization.
This is simple enough,
Very
actually,
interesting. And of course, as everybody knows, that a lot of doctors and a lot of health experts always recommend a mother's milk or breast milk is something which is very important for a child. Besides the fact for close bondness, it's also known to have a lot of antibiotics to help protect the child from any type of diseases he or she might get. Can you give us more information, sir? Why is mother's milk better than a bottle or powdered milk?
Of course, there is a huge a list of nutritional factors, but we are concentrating here about the immune factor. There are a list of immune factors present in the breast milk. We'll start simply with leukocyte, the white blood cells. It's present, you know, in the first 10 days of life more abundantly than the blood in the breast milk. And this helps. There are two main cells, macrophage and neutrophil, present in the breast milk, and this helps to engulf the bacteria and killing the bacteria and preventing our kids. This is the first factor. Second factor is antibodies. There are 4 types of antibodies present in the milk, but mainly what's called IgA. It causing painting of the intestinal epithelium and discourage the growth of any bacteria in the intestine of the baby. And the third factor, we call it the lysosomes. It's a well-known disinfectant, anti-infectant agents, present 5,000 times in the breast milk than the cow's milk or the formula. And it helps to kill the microorganism in the gastrointestinal tract. Also, there is what we call it the bifidus factor. The bifidus factor promotes the growth of the lactobacillus bifidus, and this lactobacillus bifidus discourages the growth of the pathogenic bacteria.
That's a lot of words.
Yes, and also what we call it the lactoferrin. The lactoferrin is having 3 anti-infective agents: antiviral, antibacterial, and antifungal. But what is interested is the antibacterial properties. It takes the iron from the gut and make absorption rapidly of the iron. So many bacteria, if there is no iron, it will not survive in the intestine. So it takes the iron from them and killing them by this way.
Wow.
So there is many properties.
I think the list is endless, isn't it? This is many benefits that can actually indicate why breast is best when it comes to actually feeding your children. But Dr. Manaf, tell us a little bit about the Saudi chart for immunization that we have here from birth to, let's say, 6 years or whatever it goes up to. Each different vaccine has a time that it should be taken in and a type of bacteria, a type of infectious disease that it combats. More importantly also, can you tell us from your professional perspective how parents can actually, or how the mother practically can care for the child once they've taken a vaccine, because many vaccines do have side effects, and some children, especially babies, will get a temperature, a little bit of flu-like symptoms.
Okay, most of the vaccine simply have only low-grade fever or a simple local irritation, either pain, some redness, some swelling. So it's very easy for the parents to take care of that, simply applying a cold sponge over the site of the injection, or giving some paracetamol or Tylenol or Fifadol for the fever. That's most of the side effect. Sometimes some of the vaccines may have a mild illness, like measles vaccine. Sometimes have a simple rash, continue for 1 day, some lethargy, some hypoactivity. Some of the vaccines sometimes have mild diarrhea also. So usually they are needing only reassurance, nothing more than that, or simple Fifadol, simple medicine like Fifadol.
And
or
the schedule, Dr. Manaf?
Schedule, this is very important. They should give time to the schedule, and they should arrange the schedule in advance. They make the calendar, and at that time I should prepare myself to go to give the shot to my baby. And I want to concentrate here, especially in Saudi Arabia, about the fathers. Usually the problem not in the mother. The mother are so careful about the calendar and the schedule, but the father always, I'm busy, I cannot go.
It's getting a ride there.
Yeah, I want to go for another thing. So I want to advise the father especially to give time for this very valuable things to their kids, because if the matter is a time, you can save a time. You know why? Because if your baby become la samahallah ill, you will spend more time in the hospital. Your wife will be with your baby, and your kids will be alone, and many troubles.
Many sleepless nights.
Absolutely. That's true. And sir, just to give our viewers an idea about why they should keep the time, or why they should make time to go visit the doctors for their child's vaccination. What happens, sir? What happens if we don't give our children the right vaccination at the right time? What are some of the problems or harm that can happen if we don't give them at a specific time?
There will be 3 main problems.
Okay.
First problem, you will decrease the effectiveness of the vaccine if it is not given the right time. Second, you will give a chance to develop an illness. For example, whooping cough vaccine is giving at the age of started 2 months.
Okay.
If I give my baby at the age of 4 months, these 2 months my baby is not protective, and if he develop a whooping cough, it could be a killing disease at this age. So second is giving a chance to develop an illness. And third thing, sometimes we are canceling the vaccine because for example there is a vaccine called rotavirus vaccine. If we exceed the 6 months, no need to give it, because for example this vaccine, the company studied this vaccine only in this age group. We cannot give it on the other age group. Maybe we'll have a complication. So first, it will decrease the effectiveness. Second, increase the chance of developing the illness. Third, mainly to the cancellation of the vaccine at all. There's no benefit.
And also the child's body is changing and growing and developing, so that I think the vaccine is set for a certain weight and a certain stage of the child's life. Dr. Manaf, we're speaking about the vaccine and immunization, and just initially maybe some advice to the parents watching at home. If their child is a newborn and they haven't actually had their vaccinations yet, or they don't have a strong immunity, can they still, let's say, take them to crowded areas? Can they say take them maybe to somewhere like Mecca to perform the Umrah? Because many parents sometimes really do take a lot of risks with their children's health.
Yes.
I mean, how dangerous is this?
Well, it's very difficult, and you cannot tell them don't go, they will go. I frequently advise them, especially in the first few months, 4-6 months, the immune system is not mature enough.
Exactly.
And there are many killing diseases, like for example meningococcemia. It's very common during Hajj period or Umrah, and they are taking their newborns, and we face many problems with that. So please, I want to remind them of this advice. Please try not to take, especially the small infants below 6 or below 8 months. They are immunocompromised. Exactly. They are liable for a life-threatening infection anytime. If they are taking not only to Mecca or Umrah, even in the mall or shopping areas, they are taking them to these open areas. Just wait for them, just give time. And also here I want to encourage them to improve their nutritional status, and especially vitamin D, which is an immune modulating factor. And now they are speaking about it as a very important factor in preventing the illness, and especially even in adults. I want to advise you also, because vitamin D, maybe more than 85% of Saudi women are vitamin D deficient.
Wow.
And they are finding that it can decrease up to 80% of cancer of the breast.
Exactly.
You know, vitamin D only by science exposure. So nutritional factor also is very important, especially vitamin D.
That's excellent, and I do agree with you 100%, sir, that children have a very poor immune system, and taking them to crowded places not really a good idea. But here's a very interesting fact: when children are starting school, basically that means they're going to be spending some of their time in crowded areas with their classmates, with their teachers, with the rest of the school. Basically, we know that you have to give vaccination to children from newborns until what age, sir?
We started actually from at birth. We are giving what's called BCG and hepatitis B at birth. And at the age of 2 months, we are giving influenza 6, which is diphtheria, tetanus, whooping cough, and injectable poliovirus, and hemophilus influenza type B, and also hepatitis B. Plus rotavirus vaccine, the first dose. At the age of 2 months, almost the same. Plus, instead of injectable polio, we are giving oral polio drops. At the age of 6 months, also the same as the 4 months, except the rotavirus, it's almost finished 2 doses. And then at the age of 9 months, we are giving measles vaccines. And at the age of 1 year, we are giving measles, mumps, rubella, chicken pox, oral poliovirus, and pneumococcal vaccine. Sorry, for the pneumococcal vaccine, also on 2, 4, and 6 also.
All this vaccination for a child?
Yeah.
Oh, wow.
But you know, for example, at the age of 2 months, 6 immunization in 1 shot.
Absolutely.
1 shot.
In
only.
1 shot, okay.
1 shot, yeah, 1 shot only. A single vaccine. And many are also oral polio as it drops. And at the age of 1 year and a half, we are giving diphtheria, tetanus, and pertussis 1 shot, and Hep B in 1 shot. Plus hepatitis A and oral polio. So 2 shots.
Okay, good.
And at the age of 2 years, he will finish the hepatitis A second dose, and then preschool until from 2 years until preschool, from 4 to 6 years. Here is taking booster dose of measles, mumps, rubella, and whooping cough, diphtheria, tetanus, pertussis, and oral polio drops.
So this is just to reboost the immune system again against the same infections.
Yes, of course. You know, if you face 1 case of whooping cough, you said, "Oh, I will give my son 100 of injections to save him from that." You know, this is a killing disease.
It is.
Measles. Or, some of the village in here. I know one doctor in Saudi. He said, "Our village 50 years back, my sister died of measles. Also, many people died of measles." So we are, although there is injection, but it's worth it to give it.
So prevention is better than
Absolutely, prevention is the best thing. Actually, since we are, alhamdulillah, finally getting over the flu season, because this year the flu season was quite